Stomach ulcers are sores that occur in the inside lining of your stomach or in your duodenum. There are two types of peptic ulcers. The first one is a gastric ulcer. This one occurs in your stomach, and the other one is a duodenal ulcer, which occurs in the upper part of your smaller intestine, or as stated in its name, the duodenum. Now that we know the common info of a peptic ulcer, let's move on to the symptoms. The common symptoms are stomach pains, with feeling of fullness, intolerance to fatty foods, heartburn, and nausea. And in worst case scenarios, you may end up vomiting blood or developing blood in your stools. You may find difficulty breathing, you may be feeling faint, you may have some nausea, you may have unexplained weight loss, and you may have appetite changes. Now, if you are experiencing any of these symptoms, there are ways to cure a peptic ulcer. The first one are antibiotics that can kill H. pylori, which is a common bacteria that causes the peptic ulcer. The next one are medications that block acid production and can promote healing in your digestive system. The third one are antacids that neutralize stomach acids, and medication that can protect the lining of your stomach or the upper part of your smaller intestines. So, in summary, a peptic ulcer is a very common digestive system disease. While being very hard to deal with, there are already different types of medicine and different ways that we can take care of it. Though it can be very hard to diagnose because of the symptoms. Those symptoms are very common in other diseases as well. But that does not mean we should assume that we have an ulcer. To know exactly if you have an ulcer, you should go consult a doctor or an adult who is experienced in these kinds of stuff. So, that's all from me, and thank you for listening.